had 16 operations. Today, we did 5 more operations on these patients, but luckily the patients are progressing. So earlier today, we had said there were 10 patients who were in critical condition. Some of those patients have improved throughout today and were able to be extubated, and 3 of them are now no longer in critical condition. So our patients who are currently still critical are 7. We now have 6 in serious condition and then 6 in fair condition. So patients are progressing, some faster than others, of course, and there are still many of these patients who still need operations. Both tomorrow, the next day, and Friday are planning to go back to the operating room with these patients.
Dr. Dechert, can you talk about any of the shrapnel-like material that were taken from patients and what the procedures you took to provide that to authorities?
So several patients, as you know, had fragments removed, and we do that separate from just this incident. We do that whenever there's a foreign body, such as a gunshot wound, something like that, and the evidence is handled the same each time, where as it's removed, it's sent to the pathologist who then record it, and then it gets sent on its way, so it has a chain of evidence. So that hasn't really changed. That's what we always do for this type of situation. We've been removing various things from people in the sense of it's not necessarily identified, it's just pieces of plastic, metal, just various random things. That
other medical centers have talked, the physicians there have talked about seeing things like carpenter's nails or BB guns,
right.
BBs. Any of that ring a bell?
We have not seen nails.
Okay.
We have not seen ball bearings.
It's just little particles of metal.
Particles of metal and plastic. Right, that's what we're seeing in our patients.
Of the patients who are able to speak, who are well enough to, what kind of stories are they telling you?
Believe it or not, as the doctors, we often don't ask them the stories. We usually just focus on the surgery and the care.
Are they quite traumatized though? How do they seem in themselves?
They seem remarkably calm, and most of them do have family and loved ones with them, which is nice. So they seem to be handling this very well, given the circumstances. And usually it's our social workers or the other people who work with us that sort of talk to them more about what happened, and we sort of focus on the surgery and the care.
Can you tell us how many that you have with you that have lost limbs, or what it is?
So the number hasn't changed, and I believe it was 5 total. But I don't know the count of how many it was 1 versus 2.
And do you know how many of them were runners or how many of them were spectators?
I think not all. We did have 1 runner, possibly. But not one of the critical people. All the critical people are spectators.
Of the 5 surgeries performed today, can you describe what they were?
So this was all planned operations. So the person who needed, the person who had their abdomen operated on needed to go back to the operating room, and that happened today. And then a couple people who needed their wounds, what we call, washed out, irrigated, debrided, they went today as well. So it was all planned operations.
And then what's the outlook for tomorrow? Do you think you're going to be discharging some of these people? Or are they going to
Possibly. But we're obviously taking our time with them. And a lot of these wounds, you are concerned about infection, given the nature of what happened. So it's nice to sort of keep an eye on them to make sure that they don't have an infection. But we have planned operations again for tomorrow. For maybe 9 of the patients are going to be going back again tomorrow. And then the next day, several patients again going back. So.
And then you also had a 5-year-old child?
Yes.
And what's this child?
Still critical condition. Mm-hmm. Improving.
The child's injuries, or?
I would rather not go into the detail, but
Okay.
yeah, traumatic injury from this, and he's still in critical condition.
Are the particles of metal, I know it's really hard to tell what they are or were, but is there any theory about whether they were packed into the bomb or they were the casing of the bomb?
I
or they were
couldn't really comment on that. I couldn't really comment on that. Nothing obvious that showed it was from the bomb per se.
I thought this morning you guys said BB type.
Dr. Ulrich from the ED had commented on that. I personally haven't seen BBs, but I mean, he might have, and obviously the wounds, once we remove the leg, you know, the wounds are gone and sent off to the pathologist. So, yeah.
Any other questions?
This is your name, Tracey?
Yes.
Doctor, it's Tracey?
Yep.
Dr. Tracey.
Doctor, was the 5-year-old one of the surgeries today?
No.
And you said that you're going to have 9 more surgeries tomorrow, you think?
It's several. It might be 8 or 9 that we have planned so far. So,
Have you personally ever had experience with war wounds? I don't know if you were ever in a...
no, I was not in the military. A lot of trauma surgeons have been in the military, as you can see the connection, but I have not. But our military colleagues obviously teach us a great deal about this.
Thanks, everybody.